Have you gotten your shot yet? I got 2 doses of Moderna, and I've promised to keep prednisone patients up to date at the very latest information regarding prednisone and the COVID vaccine because the data has been slow coming. I recommended it at the beginning if you only talk to your doctor, and then I recommended it to pretty much everyone because the data shows how much more harmful prednisone is, being on prednisone and getting infected with COVID is than the side effects. So now we actually have some data on some people who actually took prednisone and had a vaccination. This is brand new breaking news today, April 26th. They published this new study of people with rheumatic diseases. Those are things like rheumatoid arthritis, lupus, and other connective tissue diseases. And these people had their first dose of one of the mRNA vaccines, either Moderna or Pfizer. And they found these people on social media. That's one of the good things that social media is good for, is being able to find people with rare diseases. And then they had tested them before and after for antibodies to the COVID spike protein. And they wanted to see who actually got them. They asked them lots of questions, including which drug are you on, and if you're on more than one drug, which doses you're on, all of those things. And they figured out which people with these rheumatic diseases had the worst response from just the one shot. Now, with both of those mRNA vaccines, there are 2 shots. And so this is only after one vaccination that we have this data for. And so for these people with these diseases, about 76% of them had detectable antibodies. That means 1 out of 4 people with rheumatic diseases who had one shot did not have detectable antibodies. And that is different than the last video I made, which was about transplant patients. So people who had a heart, lung, liver, kidney transplant and were also on immunosuppressants. They're pretty much very similar immunosuppressants. They can use actually the exact same drugs. But people who have transplants are often on more than one immunosuppressant drug or higher doses or who knows what. But for some reason, people who had transplants, only 17% of them had detectable antibodies. So only 1 in 5 of transplant patients had detectable antibodies versus 3 out of 4 people who had rheumatic diseases had antibodies. So this is new information. This is really helpful for us to know what to do. And who are the people most likely to not have detectable antibodies? They were people who were on these specific immunosuppressants. First of all, mycophenolate. And they noticed this with the people on transplant medication, with transplants as well, that mycophenolate was the worst drug to be taking if you wanted to have a response to the vaccine. It's an amazing drug to be taking to keep your transplant. If you want to keep your heart, it's a really good job. But it is not helpful when you're trying to make an antibody to the vaccine. So mycophenolate is also known as Cellcept or mycophenolic acid. It has several other names in other countries, but essentially mycophenolate is the drug that we are most worried about people who are taking that because the vaccine basically isn't really working very well at all. And then the second one is Rituximab. That is also known as Rituxan, and it is an injectable, and it's also chemotherapy for the B cell. So this is all making sense why it wouldn't allow people's bodies to make an immune response. I personally took Rituximab. I had to have 4 injections of it. The first one took like 6 hours, and I had to go through that chemotherapy for my condition. So I definitely understand the need for it. It saved me, put me in remission. I'm it's like a miracle. But if you're using rituximab, the vaccine isn't going to work very well. And so what about prednisone, right? I'm Dr. Megan, the prednisone pharmacist. Wouldn't you want to know about that one? So I could only find this in the very fine print at the very bottom of one of the charts. They only had 4 people in this study who take prednisone alone. And so it was hard to tell based on just 4 people. But of those 4 people, all 4 had detectable antibodies. Yes. So in this really teeny tiny study, every single person on prednisone had detectable antibodies. I don't think this is enough data to be like, hey, if you're on prednisone, you'll get detectable antibodies, because that wasn't true for the transplant people. There were people in that prednisone group, they didn't really break it up very well, so it was really hard to tell, who didn't have detectable antibodies. So I can't really say that yet. But this is great news for people on prednisone, that it is possible to get the vaccine and have it work. And the reason you would get it is because the infection of COVID is way, way, way more harmful than any likely risk of the side effects from the vaccine. And so that is what I have to say for that update. Second is, what about pregnancy? Because I know there are people who are pregnant. The latest data is they just recently published an article in the most prestigious journal, the New England Journal of Medicine, showing that there's not any real difference between women who were pregnant without getting the shot or women who were pregnant and did get the shot. There's not really much difference. So get it. Talk to your doctor. Every single person should talk to your doctor. This is a decision for you and your doctor to make together. But according to the CDC, for pregnant women, you should get it. For immunosuppressed people, you should get it. But what about, can I stop wearing my mask, social distancing, and getting life back to normal? Yeah, maybe not yet. You should definitely, before you change any of your precautions that you've been making, talk to your doctor, because you might be one of the 1 in 5 or 3 out of 4, depending on which study we're talking, who might not have antibodies yet. So I recommend that every single person on any immunosuppressant should get antibody testing. That's how you can know. And while this study did it after just 1 dose, I would recommend continuing full precautions as long as you are in between your first dose and second dose, and at least 2 weeks after, and then try to get an appointment with your doctor to get an antibody test. That's what I would do for me. And then you and your doctor can work out whether or not you can relax restrictions for you personally, because maybe it isn't working for you. Maybe you're one of the statistic and you don't want to be that person. If you are getting your second dose, if you've already gotten your first dose and you're getting your second dose, I have a PDF of my best tips for what to do to prepare for your first or second, mostly second dose, because I had some pretty awful side effects. I was like rolling in agony in my bed for a day and a half, and it went away. It wasn't bad after that day and a half, but that day and a half was rough, especially since I'm a mother with small children and all these people are depending on me to, prepare food for them. And so I have all my tips of what I wanted. Like I was having a fever, so I wanted all these things. I was having a headache, so I wanted these things. And then, like, for example, I had all these people to feed, so it would have been nice if I had prepared a whole bunch of food in advance, so I didn't have to worry about it. So if you want a 1-page printout of all of that, just click the link below and I will email it to you personally, and it'll help you to figure out how to not be caught like I was, unprepared for suffering, because having those side effects are miserable. But what's even worse is if you are taking prednisone, getting hospitalized, being stuck on oxygen, or even worse, the ICU, being on a ventilator, or dying, because all of those things are a higher risk if you are taking prednisone. So if you want my printout of how to prepare for those vaccine side effects, just click and send me an email, say, hi, I want this, and I'll just say, I want it below, and I will email it to you if you send me an email. All right? Signing off with Dr. Megan, your prednisone pharmacist. I'm here to help you not just survive prednisone, but thrive while on prednisone. And that means getting your vaccines.